Welcome to The Checkup. I'm Modern Healthcare's managing editor, Erica Teichert. The COVID-19 pandemic has brought several healthcare industry challenges to the forefront, especially staffing issues and workplace burnout. Even as providers try to manage the pressures of working through a global health crisis, they are still expected to improve their quality and safety metrics, which can affect their reimbursement and value-based care models. Last month, the Centers for Disease Control and Prevention found hospital-acquired infections increased in 2020, especially among central line-associated bloodstream infections, catheter-associated urinary tract infections, ventilator-associated vents, and antibiotic-resistant staph infections. Joining me is Anne-Marie Benedicto, head of the Joint Commission Center for Transforming Healthcare, who works with providers to develop and improve their safety culture. Thank you for joining me, Anne-Marie.
Good morning, Erica. It's great to be here. And thank you for shining a light on this very important topic.
Well, thank you for joining us. Were you surprised by the CDC's report and the rise in hospital-acquired infections this last year?
I was not, and I will tell you why. The center has many different tools that help healthcare organizations focus on getting to zero harm. And one of our most popular and most broadly based used set of tools is what we call our targeted solutions tools, which are web-based programs, and our and hand hygiene, which is a key strategy in eliminating infections, is also something that we monitor very closely. And about 900 healthcare organizations have used our hand hygiene tool. And we did notice that even though use of the tool itself improved, so there's a lot of traffic in the tool, the number of new users declined. So every year we measure how many people are discovering the tool as a way to improve their hand hygiene. And we did notice that in 2020 that there were not too many new users, a real change from past years. And so we did expect that that there would be an effect on infections, hospital-acquired infections.
That's really interesting, considering we've all been told so much how much you need to wash your hands during the pandemic, especially early on in the pandemic.
I think there's been a real challenge in terms of how healthcare organizations and the people who work within them have managed to navigate the pandemic and work through the new challenges of treating a whole new disease and a whole new group of patients, and still continue to follow infection control protocols. I think that's been really, really challenging. And also, I think lately there has been a lot of challenges in terms of the staff themselves, that a lot of healthcare workers are leaving the various organizations and even the industry itself. And also, we have now had several surges of the pandemic. And so the people who remain are probably dealing with a lot more challenges. So less staff, which means more work for them. And there also has been record numbers of burnout reported, which also affects how you follow protocol, the number of mistakes you make. And some of those mistakes will harm patients. And also how productive and engaged an employee will feel within that environment.
Is the Joint Commission addressing workplace burnout and staffing issues as a quality and safety concern? And how are you trying to help providers with that?
So the center is a little bit different from the Joint Commission. We work directly on zero harm issues, which burnout is definitely a part of. Now, in terms of the Joint Commission has had I think a Sentinel event alert specifically on burnout that came out several years ago that is still very relevant. And it's definitely information that the center uses to do its work. What we have seen is that when organizations focus on burnout, they tend to focus on increasing the skill of the person or the employee. You know, how do you deal with stress, or how do you increase your own personal resilience? And I think that's great. It definitely focuses on wellness, but that's only one aspect of it. Burnout is a workplace phenomenon, so it is workplace driven. So there's a lot of room to step back and ask your employees, what are your barriers to doing effective work? What frustrates you in the workplace? And then taking that information and getting rid of those barriers and making it an improvement effort. So organizations are using their improvement mechanism to actually work on issues that affect how their employees come to work, how they experience their work, and how effective they are in their daily goals and how they work with patients and each other.
And obviously, burnout is something that could cause more medical errors, but I'm curious, what other effects are you seeing to the safety culture at providers from burnout?
Well, I think I was listening to an earlier interview of yours, and I heard the term that healthcare is a team sport, and that is absolutely true. So factors that compromise teamwork will affect the care patients receive. So, in terms of burnout, one of the effects of burnout is that people are exhausted, they become cynical, and they're inefficient. And so those are the kinds of behaviors that undermine teamwork and they undermine good care. So addressing the factors that lead to exhaustion, that lead to cynicism, that allow healthcare workers to feel inefficient are the ways to also combat burnout, I'm sorry, and also to make sure that you create an organization that is safer.
And how do you see hospitals managing the pressure of treating patients in a pandemic and maintaining their commitment to safety?
Yeah, I think that's a $1 million question, right? And I think it's a balancing act that organizations do every day. And I think that's also changing during the pandemic. What I have been hearing works is that healthcare leaders are asking their teams, what can we do to help you? And making that the focus, because it has been very clear that you can't get good patient care if you're not caring for your own staff. So safety begins at the employee level. And that also means that it's not leaders second guessing what could go wrong, but also asking your staff who are on the front lines, who are on the ground, what is going wrong, what could go wrong, what would make you feel more comfortable. And even though there's a lot of churn right now, there's a lot of things going on the ground, those conversations are even more crucial because I have been surprised at how long this has lasted. And so any expectation that, we'll have that conversation after, that's not going to happen. You have those conversations now so you can start as quickly as possible to make your safety culture stronger, make your workforce stronger, which will then provide the best care for patients.
I love how you're focusing also on the staff and how that if they're taken care of, that's going to lead to a safer and more productive healthcare organization overall. And I'm curious, have you seen a difference also with how long the pandemic's lasted? With each surge, has there been a shift in how providers are looking at quality and safety issues or looking at workplace burnout? I imagine there's been more of a focus on the burnout aspect, especially in this latest surge.
Yes, especially since the burnout has been going on even before the pandemic. I think that's the most surprising thing, that these are issues that have been exacerbated by the disaster and also revealed really that it has shown a spotlight on various aspects of healthcare that maybe we've taken for granted. But if we don't do something about now, then we know that it will get worse and not better. So using the pandemic as a wake-up call or as an opportunity to say, this is where we've succeeded, this is where we failed, and this is how we can build better. Because the whole system didn't quite work for us. We were hurting patients and we were hurting our staff.
Are there areas in particular that you see as big wins, or areas where we've lost in healthcare and we can do better?
Big wins. I think we know that it's not bad people; it's bad systems. And so you have people working in systems that are challenging and are still managing to heal and treat millions of people. And that is amazing. And some of what they've done is to innovate almost on the fly. the conversations that have been happening between healthcare workers, between healthcare organizations, and the innovation that feeds the need to experiment, driven by me, but still the need to experiment and to trust each other to try something new. Um, I did not expect that, and I was very gratified to see that work. Um, the opposite side of that, or the other side of the coin, is you can really see bad systems relying on the skill, talent, and goodwill of the staff who work in these bad systems. And so we've created a situation where people have to be heroes in order to do a good job. And maybe we should step back from that and create good systems so they don't have to be heroes every day, because I bet it's exhausting to be heroic every day, day in and day out. And I don't think people are made to withstand that kind of stress every day. And so that is probably part of where the burnout comes from.
That's such a good point too. Of the pressure associated with that only can ultimately would lead to more burnout, or lead to errors, leads to making those types of mistakes that then cause these issues.
So I think very much like the challenges in workplace settings that are not healthcare, where leaders are committed to creating environments where their staff bring their best to work. That is the same challenge healthcare has, because the heroes are people, and they are scared just like the rest of us. They get tired. They have family issues that they have to balance with professional concerns. So let's think of the person in that system treating another person or being a teammate to another person, and think, what do these people need? What do we need to thrive? And it's really the same. It's the exact same issue.
Are there any health systems that you've seen, or ways that you have seen various health systems, if you don't want to name one in particular, that have really improved their quality and safety, or improved that culture throughout the pandemic? What are some of the qualities that those systems have?
So one of the big structural changes I've seen through the years is the development of an improvement culture. You know, the big goal of high reliability healthcare is how to get to zero harm. And in order to get to zero harm, you need improvement tools. You need an improvement skill set and an improvement culture that goes beyond the skill set. It's also a mindset. So people knowing that if they find an error, they will not be blamed, that if they find errors, that's opportunities for improvement, that if you see high rates of pressure injuries, for instance, that you can bring a team together and address those. And so when I say it's both a skill set and a mindset, it means that these tools are so prevalent, or the use of these tools are so prevalent in an organization, that employees take it for granted that, okay, we have a problem, we'll improve it. And it's not because you're a bad person, it's because it's a problem and it's probably complex, which is why we continue to have this issue. And for instance, the center has been working with Catholic Health Services in Long Island for years now. They have a very strong improvement culture. And one of the things they did at the beginning of the pandemic is to create a patient ambassador program. They realized that with COVID being as infectious as it is, they had to change all their visitor policies, as every healthcare organization has had to do, but also how they also recognized how important family participations and visitors were to the health of the patient. And so they needed to figure out how to bridge that. So they identified the problem and identified a solution, which was to create a patient ambassador program. And the patient ambassador program were staff from the health system whose job was it to connect patients and their family members, usually virtually for sure, and using tablets and iPads. And there was a very clear training program. And they were able to do that quickly and effectively and got the results they wanted because they had an improvement culture. They had the same tool sets that everyone used. When people talked about improvement in projects, they meant the same things. And so they were able to shortcut a lot of the selling or a lot of the convincing or figuring out, because people took for granted the tools they were going to use and the results they wanted. And that training would be done in a certain way that took the concerns of the staff into consideration. And so if you think about family members wanting to comfort their loved ones or wanting to find out about their loved ones, that was huge. Um, and in talking to the organization, they talked about the range of conversations they have had to do under that program, from end of life discussions to birthday parties. And staff facilitated all of those connections. So that was a win. Another win was they were able to use employees who would otherwise have been furloughed. And so that was a win for employees as well. So that was, I think, a great program that um, started almost overnight because they had a strong improvement culture and practice.
Well, Anne-Marie, thank you so much for your time and for talking through these issues and the wins and losses we've seen.
It was a pleasure to be here. Have a great day.
You too.